I'm going to be talking about the physiological and the psychological responses to injury. First, I'm going to be talking about the physiological responses. Damaged tissue. When you damage tissue, the injured area inflames. This is basically swelling up, and it's one of the body's many defensive mechanisms. And whether you like it or not, it's going to happen, and this is the first stage of the healing process. And if you start to swell up, the area may start going red at first, and you may feel quite a bit of pain, or even just a slight pain. The next thing I'm going to talk about is the clotting mechanism, which is also known as coagulation. And this is when a blood vessel suffers damage, and this is the process of blood changing form from its usual liquid state to a solid form. And it's also, well, as I already said, it's also known as coagulation. And this is basically just when a scab's formed over a cut, and it just stops you from bleeding. The next thing we're talking about is the importance of scar tissue in the remodelling process. And this is a scar is caused by the body's repair mechanism kicking in when it's sustained an injury due to a large amount of tissue. So this is like a deep tissue injury, and scar tissue replaces any normal tissue when it's been damaged, and this scar tissue is normally quite tough, so you may need to have massages to work on it, and this gives you back your flexibility. So say a footballer sustained scar tissue damage in their leg, they would have regular massages before games because their legs may stiffen up, and it obviously free their legs up a bit so they can move them more and they're more flexible when playing. The next thing I'm going to talk about is sprains and strains. Now, some people get confused between the two, but they are different, and they're both caused when a tissue is overstretched or torn. A sprain is an injury involving ligaments, and strains are injuries involving muscles, ligament tissue and muscle tissue. And both of the injuries can cause pain and discomfort, deformity, impaired movement, swelling, bruising, and a loss of function. And a strain is when you tear or stretch a muscle or a tendon, and a sprain is when you tear or stretch one or more ligaments. And depending on how many fibres are involved, sprains and strains can be put into three categories, which are first, second, and third degree. Grade 1 is an injury to a few fibres and is only of mild severity, and it wouldn't cause much discomfort, and it would swell a tiny bit. Grade 2 is an injury to more than one fibre, and it's fairly severe. It would cause quite a lot of pain and discomfort, and it would swell quite a lot and would hurt to touch. And this would probably stop you from doing quite a lot. Grade 3, that's a total rupture and is a very severe injury. It's often said to be worse than a break or a fracture. It would cause a very large amount of pain, a significant amount of swelling, and a large amount of bruising. It may be very tender to touch, and it would also be an unstable joint. You would lose function in this area, you wouldn't be able to do anything. If it was to your leg, you'd probably be on crutches for quite a few months before it heals. Finally, I'm going to be talking about hematomas. Now, there's two different types of hematomas. It's a collection of blood outside the blood vessels, and it's usually caused by trauma. It's different to a bruise, as a bruise is the spread of a thin layer of blood under the skin. The two different types of hematomas are intermuscular and intramuscular. And firstly, intramuscular is a type of hematoma that only affects the fibre tissue of a muscle, which means that bleeding can be contained within the sheath that is surrounding the muscle. It does cause up a build of pressure, which can lead to quite a lot of pain. The reason this is painful is because the sheath surrounding the muscle takes more and more blood, and it basically acts like a balloon, and it gets bigger and bigger. This way the healing takes longer because the more blood there is, the more that has to be broken down. And with this type of hematoma, you don't usually see any sort of bruising. Next type of hematoma is intermuscular. And this type of hematoma involves the muscle and the muscle sheath, which means that the bleeding isn't contained and it spreads throughout the muscle. And although the first bleeding of this can last longer, the recovery process is normally a lot quicker than that of an intramuscular hematoma, and that's simply because the fluids are able to flow. That's simply because the fluids are allowed to flow away from the area. And with this type of hematoma, you're much more likely to see bruising take place.